Patient engagement is increasingly common. We might assume that patient engagement is universally beneficial to everyone involved. But what if it isn't? And what if it sometimes causes harm because it is done poorly? When we engage people who use or have used drugs in health system planning, delivery, and research, we know that there are benefits to the system. What we don't know are the personal impacts on the participants. How, for whom, and under what circumstances does health system engagement improve and or worsen the health and well-being of individual people who use drugs? This is what we set out to explore using a realist review. Realist reviews are useful for examining complex social interventions within complex systems. Using context mechanism outcome configurations, we develop program theory to postulate how an intervention works. The initial program theory was developed by our team of clinicians, academics, and people who use drugs, taking into account relevant literature as well as existing middle range theories. Through an iterative process, the program theory will be further refined. I invite you to explore our early program theory, refined by our preliminary extraction of 23 articles. At the center of our early program theory are the distal positive outcomes that result from health system engagement. These were decreased substance use, safer substance use, and improved mental health. Surrounding the distal outcomes are the context mechanism outcome configurations organized into the four themes that we think lead to or impede this. These are through relationships, transformation of knowledge, sense of self, and motivation. For example, Guarino et al. Explained how outreach work for people who use drugs exposes them to environments and triggers that increases their risk of relapse. But in the context of developing mutually supportive relationships with peers, it creates a sense of accountability that is protective against relapse. Our ongoing research will uncover the nuances of the underlying program theory that explains the health outcomes of people who use drugs participating in health system engagement, and will inform how we can support their health and well-being while preventing harms.